let's talk about a topic many men are curious about but rarely discuss openly. How often should you really ejaculate to support better prostate health? There's a lot of confusion, myths, and unnecessary fear around this. So let's break it down with real science and practical guidance that actually helps you make informed decisions about your body. First, ejaculation is a normal and healthy function. It's part of overall sexual wellness, and your body is designed to do it. The big question is, does frequency really matter for your prostate? According to several long-term studies, regular ejaculation may help reduce the buildup of inflammatory substances in the prostate. Think of it like housekeeping for the gland. Regular activity helps clear out old fluids, maintain circulation, and support healthier tissue. One of the most referenced studies followed thousands of men for many years. It found that men who ejaculated around 21 times per month had a lower risk of prostate issues compared to those with much lower frequency. Now, this doesn't mean you need to hit a specific number like a target. The key idea is consistency. Whether ejaculation happens through sex, masturbation, or nocturnal emissions, the pattern matters more than the exact number. But it's also important to understand that more isn't always better. Pushing yourself to ejaculate excessively when you're tired, stressed, or not in the mood is not going to improve health. In fact, sexual health also depends on balanced hormones, quality sleep, and good stress management. So the ideal frequency is really the one that fits your natural libido, energy levels, and comfort while keeping things active on a regular basis. For most men, ejaculating 2 to 7 times per week fits naturally into a healthy lifestyle. This keeps the prostate functioning smoothly without overstimulation. If you're in your 40s, 50s, or older, staying sexually active can also support testosterone balance, pelvic floor health, and blood flow. Remember, prostate health isn't based only on ejaculation frequency. Diet plays a major role. Foods like tomatoes, green tea, berries, and pumpkin seeds provide antioxidants that protect prostate cells. Staying active, maintaining a healthy weight, and managing chronic inflammation also make a significant difference. But regular ejaculation contributes to the overall equation by helping the gland perform its natural function. So instead of obsessing over numbers, think consistency, comfort, and overall wellness. Listen to your body. Keep things active in a way that feels natural for you. And if you ever notice changes like pain, difficulty urinating, or a sudden drop in libido, don't hesitate to speak with a healthcare provider. Your prostate is small, but its impact on your quality of life is enormous, so take care of it with knowledge, balance, and confidence. Regular ejaculation plays a much deeper role in prostate health than most people realize, and understanding why it matters can help men make better choices for long-term wellness. When you ejaculate, your body releases prostatic fluid. This is the fluid produced by the prostate that mixes with sperm to form semen. If this fluid stays inside the gland for too long, it can accumulate cellular debris, inflammatory molecules, and metabolic byproducts. Over time, this buildup may contribute to chronic inflammation, which is strongly linked with prostate discomfort, swelling, and increased risk of developing long-term prostate issues. Regular ejaculation acts like a natural cleansing cycle for the gland, helping remove older fluid and replace it with fresh, healthy secretions. This simple physiological process helps maintain the prostate's internal environment in a cleaner, more balanced state. Another important factor is circulation. Ejaculation increases blood flow in the pelvic region, and good blood flow is essential for nourishing the prostate, carrying oxygen to tissues, and removing waste products. When a man goes long periods without ejaculating, blood flow to the pelvic floor can become more stagnant, especially in men who sit for long hours or have sedentary lifestyles. Regular sexual activity, whether partnered or solo, stimulates the pelvic nerves, contracts the muscles surrounding the prostate, and boosts circulation. This improved blood flow supports tissue repair, reduces oxidative stress, and keeps the gland functioning efficiently. Hormonal balance is also affected. Regular ejaculation helps regulate prostate-related hormones, including testosterone and DHT. When sexual activity is completely absent for long periods, hormonal patterns can become less stable, especially in older men. While ejaculation alone isn't a hormone therapy, consistent activity supports a more predictable hormonal rhythm, which may reduce hormonal stress on the prostate and contribute to better long-term stability. Men who ejaculate regularly also tend to experience fewer episodes of congestion or fullness in the prostate. This congestion can sometimes feel like pressure, mild discomfort, or a generalized heaviness in the pelvic area. By keeping the gland active, the ducts within the prostate stay clearer, which reduces the likelihood of blockages and helps maintain smoother functioning. The prostate is a gland that was designed to be active. Inactivity is what often causes problems, not the act of ejaculation itself. There is also a psychological connection. Regular ejaculation is associated with better stress management, and chronic stress is known to worsen inflammation throughout the body, including in the prostate. Sexual release triggers relaxation hormones, reduces tension, and can even improve sleep. These indirect benefits further protect the prostate because a calmer, healthier body experiences less inflammatory stress overall. Ultimately, regular ejaculation is not about forcing a number or achieving a target. It is about maintaining a natural rhythm that supports the gland's biological processes. The prostate performs best when it is used consistently but comfortably, without extremes. By allowing the gland to perform its natural function regularly, you support its long-term health, reduce inflammatory risks, improve circulation, and help maintain internal balance. Regular ejaculation is a simple, natural action the body is built for, and when practiced consistently, it becomes one of the easiest ways to care for your prostate. The idea that ejaculating around 21 times per month may lower the risk of prostate issues comes from one of the most widely discussed studies on male reproductive health. But what matters even more than the number is the science behind why this frequency showed benefits. When researchers followed thousands of men over several decades, they observed a clear pattern. Men who ejaculated more frequently tended to have fewer prostate-related problems later in life. This doesn't mean that 21 is a magical number. Instead, it reflects a lifestyle where the prostate remains consistently active, preventing stagnation of fluids and reducing inflammation inside the gland. When ejaculation happens regularly, the prostate stays in a state of healthy turnover. Prostatic fluid, rich in enzymes, zinc, proteins, and minerals, is meant to be released and replenished often. If it sits inside the gland for too long, the older fluid can become thicker, more acidic, and more likely to contribute to irritation. It is similar to how standing water becomes stale over time. By contrast, consistent ejaculation helps flush out old fluid and replace it with new, healthier secretions. This reduces the accumulation of harmful byproducts that can trigger inflammation. Inflammation is a major underlying factor in many prostate conditions, including enlargement and chronic discomfort. The 21 times per month observation simply suggests that men who maintain a steady rhythm tend to benefit from this natural cleansing cycle. Beyond fluid turnover, ejaculation has an impact on cellular health. Every time the prostate contracts during ejaculation, it stimulates micro movements within the gland that help maintain ductal flexibility and prevent blockages. Over time, these small contractions keep the gland functioning smoothly. Men who rarely ejaculate may experience more congestion, stiffness, or inflammatory buildup, especially as they age. The study highlighting 21 ejaculations was not promoting high sexual activity as a requirement, but rather showing how long-term patterns influence prostate resilience. Another factor is hormonal balance. Men with regular ejaculation patterns often show more stable levels of testosterone and lower levels of stress hormones like cortisol. This matters because hormonal imbalance directly affects prostate cell growth. High stress and inconsistent hormonal rhythms can create an environment where the prostate becomes more reactive, more inflamed, and more prone to enlargement. Regular sexual activity naturally regulates these hormones, creating a calmer, healthier system overall. The frequency observed in the study simply reflects a balanced pattern that supports hormonal stability. Mental and emotional well-being also play a role. Men who maintain regular sexual expression often report reduced stress, better sleep, and improved mood. All these factors indirectly support prostate function because the body functions better when stress is controlled. Chronic stress weakens immune defenses and increases inflammation, two major contributors to prostate problems. The men with higher ejaculation frequency in the research likely benefited from the stress-reducing effects of consistent sexual release, which further protected their prostate health. The key takeaway is that the 21 times per month figure is not a prescription. It is an observation that reflects the benefits of a consistently active reproductive system. The real message is that the prostate thrives when used regularly. What matters most is establishing a pattern that is natural, comfortable, and sustainable, because your long-term prostate health depends more on consistency than on hitting a specific number. For most men, an ejaculation frequency of about 2 to 7 times per week naturally supports prostate function without causing strain or overstimulation, and this range aligns well with how the male reproductive system is designed to operate. But understanding why this range works and why it is considered ideal for a large number of men helps clarify the real science behind prostate wellness. It's not about being overly active or trying to push your body beyond its comfort level. Instead, it's about maintaining a consistent rhythm that keeps the prostate functioning efficiently while respecting your natural libido and energy levels. The prostate is fundamentally a gland created to produce and release fluid regularly. When ejaculation occurs within a steady, moderate range, such as 2 to 7 times weekly, the gland is able to cycle through a healthy pattern of producing fluid, releasing it, and then replenishing it. This prevents stagnation, reduces the buildup of inflammatory particles, and helps maintain a smoother internal environment. If ejaculation happens too rarely, the gland becomes more prone to congestion, which can lead to discomfort, swelling, or a sluggish feeling in the pelvic region. When ejaculation happens too frequently, especially in forced or stressful ways, the prostate and pelvic muscles can become irritated or fatigued. The middle range, consistent but balanced, is what typically offers the greatest benefit. Another reason this range is beneficial is because it supports a healthy balance of sympathetic and parasympathetic nervous system activity. Sexual arousal, climax, and recovery involve complex interactions between these systems. A moderate frequency helps maintain responsiveness without overstimulation. When sexual activity becomes excessive, the nervous system can become overworked, leading to lethargy, decreased libido, or pelvic muscle tension. On the other hand, too little activity can weaken responsiveness, lower pelvic circulation, and reduce the natural contractile strength of the prostate. Maintaining a rhythm of 2 to 7 ejaculations weekly keeps these systems harmonized and functioning smoothly. Age also plays a major role in determining how this frequency supports health. Younger men may naturally feel comfortable at the higher end of this range, while men in their 40s, 50s, and beyond may find the lower or middle end more realistic and balanced. As men age, the pelvic floor muscles change, prostate sensitivity shifts, and hormone levels evolve. Ejaculating regularly without overdoing it supports testosterone regulation, reduces stress hormones, and keeps the reproductive system engaged. It essentially helps maintain the natural rhythm the body relies on for long-term stability. This frequency also intersects with lifestyle factors. Men with active lifestyles, good sleep habits, lower stress levels, and a balanced diet tend to find it easier to maintain a healthy sexual rhythm. Ejaculation is not just a physical release. It interacts with mood, mental clarity, confidence, and emotional well-being. The moderate range encourages sustainable habits that enhance both physical health and psychological balance. Meanwhile, men who rarely ejaculate often experience higher levels of tension, irritability, or pelvic discomfort, all of which can indirectly affect the prostate. The ideal frequency isn't a rule, it's a natural zone where most men feel their best, physically and mentally. The 2 to 7 times per week range simply reflects what the body can comfortably sustain without strain. The most important factor is staying consistent in a way that feels natural. When your body is respected and listened to, the prostate responds positively, supporting better long-term health and overall vitality. Ejaculation doesn't need to come from only one source to support prostate health. And this is an important point many men overlook. Whether ejaculation happens through sexual intercourse, masturbation, or spontaneous nocturnal emissions, the prostate benefits in a similar way because the key factor is the release of prostatic fluid, not the method. The body does not differentiate between the types of sexual activity. It responds simply to the physiological process of fluid release and the contraction of the prostate during climax. This flexibility is actually one of the body's natural strengths, ensuring that even men who may not be sexually active with a partner can still maintain healthy prostate function. Sex, for example, provides not only the mechanical release of fluid, but also emotional intimacy, increased heart rate, and hormonal stimulation. During partnered sex, oxytocin levels rise, stress hormones decrease, and circulation improves. All of these indirectly support prostate health. But masturbation provides many of the same physical benefits. It engages the pelvic nerves, stimulates blood flow, triggers hormonal release, and helps flush out the prostate. For many men, masturbation becomes more important as they age, experience changes in libido, or go through periods without a partner. It allows the prostate to remain active without relying on another person's availability or sexual timing. Nocturnal emissions, commonly called wet dreams, also play a natural role in maintaining prostate function. Although more common in younger men, they can still happen in adulthood, especially during periods of abstinence. This demonstrates that the body has built-in mechanisms to release excess fluid when needed. Nocturnal emissions indicate that the reproductive system is responding naturally and that the prostate is doing exactly what it's meant to do. Some men feel concerned or embarrassed about this, but it is actually a sign that the prostate is functioning normally and preventing fluid stagnation. Understanding that ejaculation can occur through multiple pathways reduces the pressure many men feel about maintaining their sexual health. While studies often talk about frequency, they do not require the ejaculation to come from intercourse alone. What they point to instead is regularity, keeping the gland active in a way that feels natural and achievable. This also helps men who may face challenges such as performance anxiety, erectile difficulties, or changes in libido. Even in these situations, the prostate can still be cared for through masturbation or natural emissions, ensuring it continues to work efficiently. Another benefit of recognizing multiple sources of ejaculation is that it helps men avoid guilt or unrealistic expectations. Modern life can be stressful, relationships can shift, and health conditions can arise. Knowing that the prostate does not depend on a single method of release allows men to adapt their sexual habits to their circumstances without compromising health. It also gives aging men more control, as partnered sex may not always be frequent, but maintaining prostate function still remains within their reach. Ultimately, prostate health is supported by the act of ejaculation itself, regardless of how it occurs. The pathways may differ, but the benefits, reduced congestion, better circulation, improved hormonal balance, and lowered inflammation, remain consistent. The key is not how you ejaculate, but that you allow the body to perform this natural function regularly. This understanding empowers men to take charge of their reproductive wellness in a practical, flexible, and confident way. While regular ejaculation is beneficial for prostate health, it's equally important to understand that more is not always better. Many men mistakenly believe that pushing themselves to ejaculate excessively, far beyond their natural desire, is somehow going to supercharge their prostate function, boost testosterone, or provide additional health benefits. In reality, the male reproductive system doesn't work that way. The body operates on balance, rhythm, and biological limits, not brute force. Overdoing ejaculation can strain the pelvic muscles, irritate the prostate, and disrupt the nervous system, creating the opposite of the intended effect. When men attempt to exceed their natural libido frequently, the first system that gets stressed is the pelvic floor. These muscles support the prostate, bladder, and sexual organs, and they're involved in every orgasm. Excessive sexual activity or forced ejaculation can cause tension, spasms, or fatigue in these muscles. This may lead to symptoms like pelvic pressure, aching, or difficulty achieving strong orgasms. A tired pelvic floor can also affect urinary flow and contribute to discomfort that feels similar to prostate irritation. What was meant to be healthy ends up creating unnecessary strain. The prostate itself can also become irritated if ejaculation happens too often in a short period. Although the gland benefits from regular activity, it also needs time to recover and replenish its fluid stores. Frequent ejaculation without allowing the body adequate time to rest can lead to temporary inflammation, creating sensations like heaviness, mild burning, or pressure. These symptoms don't necessarily indicate a medical problem, but they are signals that the body is being pushed beyond its natural rhythm. The gland thrives on consistency, not extreme, so moderation becomes essential. Another important consideration is the nervous system. Sexual activity requires coordination between the sympathetic and parasympathetic systems. Excessive masturbation, repeated stimulation, or forcing arousal when the body is not naturally ready can disrupt this balance. That disruption may lead to decreased libido, difficulty maintaining erections, or a general sense of fatigue. Many men misinterpret these signs as sexual dysfunction or hormonal imbalance, when in reality, the system is simply overstimulated and needs time to reset. Balanced ejaculation frequency protects these pathways from burnout. Hormonal fluctuation also comes into play. While ejaculation supports hormonal stability, too much activity can temporarily lower energy, weaken motivation, or cause fluctuations in testosterone response. This doesn't mean testosterone is permanently affected. It simply means that the body feels depleted from excessive stimulation. The natural hormonal cycle works best when ejaculation is regular but not excessive, aligning with your body's comfort zone rather than pushing beyond it. Stress levels and mental well-being are also tied to ejaculation frequency. Some men develop anxiety or guilt when trying to meet unrealistic expectations, either too low or too high. When men attempt to ejaculate more often than their natural desire, sex becomes mechanical, pressured, or emotionally disconnected. This stress contradicts the very benefits ejaculation is meant to support. Healthy sexual expression should feel effortless, not forced. Ultimately, moderation protects the prostate more effectively than extremes. Regular ejaculation keeps the gland clear and functioning, but pushing too far can create irritation instead of improvement. Your body communicates its needs through desire, energy levels, and comfort. Listening to those signals ensures that you stay within a frequency that supports long-term prostate wellness. In other words, Ejaculation should enhance your health, not become a task you feel obligated to perform. Balance is the true key. Prostate health is influenced by far more than ejaculation frequency alone, and understanding the bigger picture is essential for long-term wellness. While regular ejaculation helps clear the gland and maintain its internal balance, it cannot compensate for poor lifestyle choices, chronic inflammation, or unhealthy habits. The prostate is sensitive to the chemical environment of the body, which means diet, exercise, stress, sleep, and overall metabolic health all play powerful roles in how well the prostate functions and how it ages. Ignoring these factors while focusing only on ejaculation is like trying to maintain a car by changing the oil but never checking the engine, tires, or fuel quality. True prostate health requires a more comprehensive approach. One of the most important factors is diet. The prostate responds strongly to what you eat, especially foods high in antioxidants and anti-inflammatory compounds. Lycopene tomatoes, catechins from green tea, zinc from pumpkin seeds, and polyphenols from berries all help protect prostate cells from oxidative stress, which is a major contributor to enlargement and chronic irritation. Processed foods, excessive sugar, and high-fat meals increase inflammation, which can aggravate the prostate and worsen symptoms like urinary frequency or pelvic pressure. A diet rich in whole foods, lean protein, healthy fats, and colorful fruits and vegetables creates an anti-inflammatory environment that supports long-term gland health. Exercise is equally important. Regular physical activity reduces body fat, improves circulation, and lowers inflammatory hormones. Men with sedentary lifestyles are more likely to develop pelvic congestion, metabolic syndrome, and hormonal imbalance, all of which negatively affect the prostate. Even moderate exercise such as brisk walking, cycling with proper posture, swimming, or strength training improves blood flow to the pelvis and supports better hormonal regulation. Exercise also boosts testosterone naturally, which indirectly benefits the prostate by helping maintain healthy male physiology. Stress management is another crucial factor. Chronic stress raises cortisol levels, which disrupts hormones, increases inflammation, and weakens immune function. High stress is known to trigger or worsen symptoms like pelvic tension, urinary urgency, and overall prostate discomfort. Learning to manage stress through meditation, breathing exercises, outdoor activities, or hobbies can dramatically reduce inflammation throughout the body, including in the prostate. Emotional health and prostate health are more closely connected than most men realize. Sleep also plays a major role. During deep sleep, the body repairs damaged tissues, regulates hormones, and resets inflammatory pathways. Poor sleep weakens the immune system and contributes to hormonal imbalance, both of which can worsen prostate issues over time. Prioritizing consistent, restful sleep helps maintain stable testosterone levels and reduces the kind of chronic inflammation that affects the prostate. Hydration and urinary habits matter as well. Drinking enough water helps flush the urinary tract and reduces irritation, while holding urine for long periods can strain the bladder and increase pressure on the prostate. Simple habits like emptying your bladder regularly and avoiding excessive caffeine or alcohol can make a significant difference in long-term comfort. The key message is that ejaculation is only one part of prostate health. It's helpful, but it's not the whole picture. The prostate thrives when supported by balanced lifestyle habits that reduce inflammation, promote circulation, and maintain hormonal stability. By combining regular ejaculation with a healthy diet, consistent exercise, stress control, and good sleep, men create the strongest foundation for a healthy prostate throughout life. In the end, your prostate health comes down to balance, consistency, and understanding your body's natural rhythm. Ejaculation is just one of the tools your body uses to keep the gland functioning at its best, but it works even more effectively when supported by healthy habits, good nutrition, regular movement, and stress control. What matters most is not chasing numbers or forcing yourself into unrealistic patterns, but staying in tune with what feels right for you. When you honor your body's signals, maintain a steady routine, and take simple daily steps to reduce inflammation and support circulation, you give your prostate the environment it needs to stay strong and resilient. Caring for your prostate is not complicated. It's about small, consistent choices that protect your long-term vitality and confidence.